Okay, so we're going to do the middle of the three new 120s, or I'm sorry, free 120s that are available. I got the very first question wrong. They wanted to give this patient lactulose, a very, very reasonable thing to do as a 68-year-old dude with lethargy and tremors. And that's what happened is I read it as tremors, but really they're saying that they had asterixis. Asterixis is very specific, so to speak, with hepatic encephalopathy. So it wasn't thiamine or benzo. It was actually just good old lactulose. Not a terribly um, difficult thing to come to the conclusion of. Just didn't do it at the time. Uh, Next, we got number two wrong. So it was saying it was a 45-year-old woman with emergency department 3-day history of progressive shortness of breath, and you wanted to get a ANCA test on her. So they're just saying that it's a young person, woman in this particular instance, with adult onset asthma, hemoptysis, fever, and sensory abnormalities of the upper and lower extremities. It is a eosinophilic granulomatosis with polyangiitis. That's a good point. The sensory abnormalities of the upper and lower extremity was apparently somewhat of a um, giveaway for this. They're saying that they came up with the mnemonic. It is pan, palpebral asthma, neurologic symptoms like wrist drop, is a Churg-Strauss slash eosinophilic granulomatosis with polyangiitis type of situation. Next one is number 9. 9 got this one wrong. They wanted to measure the post-void volume. I was thinking that this patient had like kidney stone type of thing. They were 70 years old, dark urine, decreased urine output, but mild pain. And they were saying that this ended up being an acute kidney injury, likely post-renal with the BPH. And the best way to work that up would have been with the bladder ultrasound. Next one is number 10. This was a 52-year-old woman with 2-day history of severe pain and markedly decreased range of motion. They gave her a leukocyte count in her hot joint of 60,000 with no growth, and that still ends up being septic arthritis. And they want to use vancomycin in septic arthritis. 12. This is just a specific thing for data. 14. They're saying that if the HIV patient is taking the medications that they are supposed to, that they're going to die of the same thing that's the number one cause for everybody else, and that's cardiovascular disease. 15 is, I actually got 15 right, never mind. Next one is 28. All right, 28 was a bee sting on the right cheek of their face. And they were saying that they wanted to just cleanse the site and apply ice. I guess since they gave that to you as a first option, that's almost somewhat fine. Um, they're saying that there were no signs of anaphylaxis, which I mean, I guess so. And they weren't having vision problems or ophthalmoplegia yet. So you could still say conservative, but it just was a little weird to have an injury so close to the eye and then have them just be like, yeah, that's fine. But that's what they want. Unless they have actual signs of anaphylaxis or they are having actual signs of eye problems, then you can just cleanse the site and apply ice if they get bit on the face by a bee. Next one is 35. 35-year-old woman is evaluated for a persistent fever 4 days after admission for treatment of pyelonephritis. Oh yeah, so they're saying that she was getting medicine for her pyelonephritis and it didn't get better. So the thing you can do is a CT scan of the abdomen and you can check and see whether or not there's any abscesses or whether or not there's a kidney stone that's making it worse. You can kind of just look into different things that could happen. They didn't have cultures exactly back yet, but in this particular instance, she had been getting medicine for a while and she wasn't getting better. So you can do CT to try and see if you can find a reason why that might be. Last one for this section is 39. 52-year-old woman with type 2 diabetes comes to the office for follow-up visit 2 weeks ago. So she had acute kidney injury. She had been recently started on lisinopril. I guess what they're saying is that if you start lisinopril, yeah, I mean, you can affect the amount of volume that's going into the kidneys. That's fine. I think there just really wasn't like a lot of other stuff to go with. This one, I think they had Hyalin casts. There weren't really a lot of other options, but if they have a recently started the ACE inhibitor, you can consider acute kidney injury if they have a increase in creatinine. So now we're going to move on to the second section. This one will start with question number 2. 5 days after admission to the hospital for management of ST elevation, a 59-year-old man has a aortic embolism. This one, they were trying to give it to you because they were saying that they had cyanosis at one level and lower. They were saying that they had cyanosis like at the level of the nipples or ribs or something like that. But there was no lung crackles, so the left heart was doing fine. And oh, I'm sorry, that's for right ventricular failure. Yeah, I don't know. I mean, aortic embolism, they're just saying that this is something that can happen 5 days after a heart attack, and you might have cyanosis of the body that happens in a pretty cut off area if you have an embolus. Next one is going to be 12. Yeah, 12 is Vader, and they're saying that the T in Vader is the trachea, and they're saying that they had a harsh cough, and it gets worse with forced breathing. They have expiratory stridor, and that ends up being tracheal collapse. They want you to know that forced vital capacity is almost always about equal to slow vital capacity. If you have a difference in between those two things, then you have to consider that it could be tracheal collapse. 21. "87-year-old woman." Oh yeah, we just read this one. We just read this wrong. It's clearly on the outside. So the outside is vulvar carcinoma. It wasn't on the inside, which would have been cervical carcinoma. Just read it wrong. 27. Here they're saying that it's very, very obvious she's having pseudo seizures. There's no postictal state. There's no tongue biting, no incontinence. But in order to confirm the diagnosis of a pseudo seizure, you have to do a video EEG to say that it's not an actual seizure. And that's really that's the best and easiest and cheapest way you could have done that. They don't want you to just jump to the counseling, although that patient might need counseling at some point. The counseling isn't going to like give you a diagnosis that you want there. 30. You just do follicle stimulating hormone to confirm menopause. Did see a different question somewhere else that was saying if you had a hysterectomy or a tubal ligation that you could do it 6 months afterwards. This one, she didn't have any of that kind of history. So she followed the traditional year of 1 year, traditional rule of 1 year, and just did the FSH testing. So 34 was 27-year-old, 41 weeks gestation. Baby has neonatal respiratory distress syndrome. Because what would she be at risk for? So if you give the mom opioids, then it's possible that she'll get a like low activity, low respiratory drive baby as well. 36. If you have Charcot's joint, you're supposed to immobilize that, put it in a posterior splint. They might just give you an x-ray of somebody's foot who has type 2 diabetes and maybe some like recent insult, but then they're not actually sick. So you have to walk off from the osteomyelitis thing and just say, okay, well, this is probably just Charcot foot. And for that type of person, you want to offload the foot, prevent further fractures, and you can do that with splinting and immobilization. Remember that they don't want you to do very many surgeries if you can avoid it at all on somebody's foot if they have diabetes because they have poor blood flow. Last one from this section is 38. The patient has aortic stenosis. He has systolic ejection murmur loudest at the aortic area, the right second intercostal space with radiation to the carotids that increases in intensity with increased preload. Just remember, if the period of silence is longer than the period of the murmur, then it's more likely a systolic murmur. Last section, start with number 1, which is 81 overall. They are saying that the thing that makes them at most risk for suicide is having alcohol use disorder. Next is 5. A 9-month-old who had weird bullae on their butt. They were saying that those were probably cigarette burns, and so you needed to insinuate that they needed a skeletal survey to help rule out child abuse. 6 is a gallbladder issue, so you always do ultrasound for gallbladder issues, and pretty much always. I thought that ERCP would be fine here because I thought that it was a good chance that it was gallbladder pancreatitis, but they still want you to just do the right upper quadrant issue here first. They're saying that gallstone pancreatitis is not caused by a stone stuck in the biliary tree, but rather a spasm of the main pancreatic duct where it meets the common bile duct due to irritation from a passing stone. And a little bit of a bad streak here. So we also have 7 wrong. This was umbilical cord prolapse. The baby's heart rate just dropped out of nowhere. It was doing fine in the 110 to 160 range, and then all of a sudden it just dropped. The mom's kind of dropped a little bit ever so slightly too. They're just saying that fetal bradycardia, variable decelerations, and a prolonged deceleration of 1 minute or longer is their somewhat giveaway for umbilical cord prolapse. Next one's 13. 13 is cellulitis plus gross things. So cellulitis plus pain out of proportion, rapid progression of symptoms, severe systemic features, crepitus of air, in this case bullae, in this case purulent cloudy discharge, violaceous appearance of lesion, or paresthesia, anesthesia at the edge of lesion. This is necrotizing fasciitis, and they have to go directly to the emergency room or directly to the operating room. If it happens in the perineal area, it's called Fournier's. Now we get a little hot here. We're going to go all the way to 29. (29) is spontaneous bacterial peritonitis. You normally want to give this person ceftriaxone. They didn't give them that option, so the next best option was cefotaxime. I get it. They just want a 3rd-gen Ceph here, so you're going to go ahead and give it to them. They have altered mental status with diffuse abdominal tenderness and a temperature above 100 degrees. So your suspicion for SBP should be pretty high. You can do a paracentesis to confirm. Next is 38. Okay. 38 was kind of just a made-up thing. Never heard of this before, but apparently if you eat MSG, you can have nausea, facial flushing, and chest pressure. it was obvious that it was related to the eating, but they were saying that apparently it didn't fit perfectly for it to be systemic mastocytosis because that's a rare disorder due to accumulation of mast cells. Episode would be similar to allergic reaction. And I kind of thought that that's what this was. I kind of thought they were saying that it was going to be like anaphylaxis type of like mass cell degranulation type of thing. But because she was eating at an Asian restaurant, then you had to read between the lines that it was nausea, facial flush, and chest pressure in relation to MSG. I kind of doubt that this would be on any test now. And then the last one is the S1 radiculopathy in a 47-year-old woman with 2-month history of progressive weakness and numbness of her right leg. She had a risk factor because she was heavy lifting, and now she has weak hamstrings, so she's got poor knee flexion, poor plantar flexion, decreased Achilles reflex was the biggest thing, and that matches with S1 radiculopathy. So I'll just go over the things here. They're saying L3 is raise your knee, L4 is kick the door, L5 lift your big guy, S1 jump for fun. So L5 lift your big guy, so dorsiflexion. S1 jump for fun is plantar flexion, and that's kind of just the way that you can kind of start to cover that. You can know that L3 is covering the medial leg at the level of the groin and the nerve rods spiral around the leg thigh from the medial surface to the anterior surface, which is L4, to the lateral surface, which ends up being L5, and the posterior surface ends up being S1. If you want to know the reflexes, L2, 3, 4 is kick the door, that's patellar reflex, and S1, 2 is buckle my shoe, and that's Achilles reflex.